Hi, this is Lewis. This is a follow-up on my first video about my spinal decompression surgery. So these are some of my post-op days. I'm on post-op day uh, 1 week plus 1 day. So my first day after surgery, I was in a lot of pain. They give you the medication, the pain meds at night to make you sleep well or make you comfortable, and I think that went pretty well. So I had to do occupational therapy and physical therapy where I walked around the unit. It showed them I could walk up and down stairs with no problem. So that went okay. So I also had some drains. They're very similar to, if you can do a Google search on Jackson Pratt drains. They're very similar to that, to where they're like little little cylinders that are compressed like a spring. And what that does is the tube that comes out of it provides suction, so it's constantly draining off fluids from your surgical site so it can heal up. So after I was able to get those out, those were one of the key things to me being able to go home. So I got all that done and I was able to go home. Big mistake. Um, 'Cause if you've had surgery before, the anesthesia and all that medication they give you sort of lasts in your system for a while, so you're not feeling as much pain as you would regularly feel. Once that stuff wore off, after I got home, it was pain big time. It hurt pretty bad. I couldn't get up and down the steps very well. So hate to tell you this, but I cried like a little girl when I tried to get in bed one time. It was just hurting that bad, so I just sucked it up and just stayed in the bed that night. But I ended up spending the next 2 nights sleeping in my recliner. Uh, Luckily, we bought a pair of recliners last year with heat and massage, very oversized, comfortable. So I was able to sleep in my chair for the next couple days. So that got me through that. So um, one of the other things I've had is I'm currently wearing a back brace. I'll get up and try to show it to you, along with my Minnesota Wild stuff. This is a brace. It's got these two little doohickeys here, and it's got these little wings. So I just cover this up here, cover it up there, grab these two little almost like rip cords, tighten them up, put them there, and that holds my back together very well. I really, really like the brace. I think it's a showstopper because it really gives me support and it doesn't make movement as painful. So one of the things I've run across this week is usually after 5 days, you're able to take off your bandage and you can take a shower, which I was definitely looking forward to. The sponge bath thing don't do it for me, but I couldn't. My my drain, not my drain, but my wound was weeping, so it was constantly wet. So I had to keep changing it. So I was a medic in the army. You always want to look for infection. That's the worst thing, to get your wound infected. So I called the nurse. She says, "Well, let's give it one more day. If it's still weeping, then I need you to come in." So today I went to the nurse, took a look at it. It didn't smell. One of the big things about infection is, one of the clear signs is that your wound is infected if it smells nasty. If the discharge is an off color or like a pus color, which is kind of thick, those are sure signs that you have an infection. You have to watch out for like your fever and stuff like that, or if you're getting the chills. But let me give you my disclaimer that I'm not a medical person. I'm not giving medical advice. I'm just a guy with a bad back. So with that being said, today I went to see the nurse. She's a nurse practitioner, very good. She took a look at it, cleaned it off a little bit, and gave me some antibiotics to take for 10 days along with some more dressings. She said, keep changing the dressings as you need to keep the wound clean. So I'll start my antibiotics today, and I'll see how it goes from there. So far, each day the pain is becoming less and less. I'm able to walk up and down stairs. I don't do it a lot because I don't want to press my luck. And I had my surgery last Thursday and today is Friday. This is the first time I've been out of the house in a week, well, a little over a week. So needless to say, I was going stir crazy. And it just felt so good to get outside, get some fresh air. Even below zero, air is better than sitting in the house watching Netflix, Wendy Williams, and TMZ all day. You can only have so much of that before you go crazy. So I will give you an update in a week or so about what's going on and what you may need to expect. Once again, this is Lewis, aka MD Spider, signing off. Please feel free to leave comments, questions, and I'll get back to you in an expedient manner. I can only tell you what I feel. I can't give you any medical advice. I can only tell you what happened to me. All right, you guys have a good day, and I'll follow up with you shortly. Thank you.